Security Council members are holding a video conference open debate on ensuring the equitable access to COVID-19 vaccines in context affected by conflict, rather the continent, of course, countries that are affected by conflict and insecurity. Let's take you there.
The provisional agenda for this meeting is maintenance of international peace and security, implementation of Resolution 2532 of 2020. And so with your permission, I will adopt the agenda. Next, we move on to the invitations under Rule 39. And in accordance with Rule 39 of the Council's Provisional Rules of Procedure, I would like to invite the following briefers to participate in the meeting. Ms. Henrietta Foray, Executive Director of the United Nations Children Fund, Mr. Jagan Chapgayan, Secretary General of the International Federation of the Red Cross and Red Crescent Societies, and Dr. Seth Berkley, CEO of Gavi. It is so decided. Now we move on with all of your permissions to consideration of item 2 of the agenda. And so I will draw the attention of council members to document S/2021/138, which is a letter dated the 12th of February 2021 from the permanent representative of the United Kingdom to the United Nations, addressed to the Secretary General and transmitting a concept paper on the item which is before us under consideration. And with that in mind, I will now give the floor to Secretary General, His Excellency, Mr. Antonio Guterres, to make his introductory remarks. Antonio, over to you.
Mr. President, and with your permission, I would make a brief introduction and then ask my colleague Henrietta Foray, Executive Director of UNICEF, to develop our briefing. Excellencies, ladies and gentlemen, I thank the United Kingdom for organizing this meeting and for reinforcing my call for a global ceasefire to ease suffering, create space for diplomacy, and enable humanitarian access, including for the delivery of vaccines worldwide. COVID-19 continues its merciless march across the world, upending lives, destroying economies, and undermining the Sustainable Development Goals. And the pandemic is exacerbating all the factors that drive instability, hindering our efforts to implement Security Council Resolution 2532 for the cessation of hostilities, for conflict prevention and resolution. Defeating COVID-19, now that we have begun to have the scientific capacity to do so, is more important than ever. The rollout of COVID-19 vaccines is generating hope. But at this critical moment, vaccine equity is the biggest moral test before the global community. We must ensure that everybody, everywhere, can be vaccinated as soon as possible. Yet progress on vaccinations has been widely uneven and unfair. Just 10 countries have administered 75% of all COVID-19 vaccines. Meanwhile, more than 130 countries had not received a single dose. And those affected by conflict and insecurity are at particular risk of being left behind. When pandemic strikes, we are only safe if everyone is safe. If the virus is allowed to spread like wildfire in the global south or parts of it, it will mutate again and again. And new variants could become more transmissible, more deadly, and potentially threaten the effectiveness of current vaccines and diagnostics. This can prolong the pandemic significantly, enabling the virus to come back to plague the global north. And it will also delay the world economic recovery. We have come together to create the COVAX facility, the one global tool to procure and deliver vaccines for low and middle income countries. COVAX requires to be fully funded. But we must do even more. Our efforts need to be comprehensive and well coordinated everywhere. The world urgently needs a global vaccination plan to bring together all those with required power, scientific expertise, and production and financial capacities. I believe the G20 is well placed to establish an emergency task force to prepare such a global vaccination plan and coordinate its implementation and financing. This task force should include all countries in which there is a capacity to develop vaccines or to produce them, if licenses are available, together with WHO, Gavi, other relevant technical organizations, and international financial institutions. And the task force would have the capacity to mobilize the pharmaceutical companies and key industries and logistic actors. I am ready to galvanize the full United Nations system in support of this effort. The G7 meeting later this week can help create the momentum to mobilize the necessary financial resources. Together, we can ensure sufficient supply, fair distribution, and vaccine confidence. And we can defeat this disease. We can get our economies running again. I am convinced it's possible. Let's make it happen together, and I thank you.
Thank you, Secretary General, for your remarks. And now I understand that the Secretary General has to leave the meeting at 9:25 a.m. because of other pressing commitments and priorities. So can I also just take this opportunity to thank you for all of your work, your leadership, and indeed the work on the front line of so many UN staff right around the world. I'll now give the floor to Ms. Henrietta Fore.
Thank you very much, Secretary General, Excellencies, fellow briefers, Secretary Raab. Thank you for convening this debate. UNICEF appreciates the United Kingdom's efforts to shine a light on the importance of equitable access to the COVID-19 vaccines. The only way out of this pandemic, as the Secretary General has just said, for any of us, is to ensure vaccinations are available for all of us. In this historic effort, we must include the millions of people who are living through or fleeing conflict and instability. Equitable access to vaccines for all people, including those living under conflict, is essential. Not only is it a matter of justice, but as the only pathway to ending this pandemic for all, and to sowing the seeds of care, of hope, and even peace in countries that have seen far too little. For UNICEF and our many humanitarian partners working around the world, COVID-19 has fundamentally altered our responses, adding a new layer of complexity in some of the most difficult and dangerous operating environments anywhere. As this Council knows well, the violent, protracted nature of today's armed conflicts shatters countries' health system, damaged or destroyed vital infrastructure like water and sanitation, and spurred the flight of badly needed healthcare workers. In this context, vaccine delivery is also hampered by a funding gap for humanitarian support overall, and by a lack of transportation, cold chains, logistical infrastructure to support the rollout. We need to reach the same populations that are routinely missed with basic services like health, nutrition, and basic immunization, with a vaccine that will not only potentially save their lives, but also help to address the global pandemic. UNICEF is proud to support the WHO-led global response, and we're bringing our decades of experience and expertise to this massive act. We are working with our partners and governments to support country readiness. With our vast field presence in every country, we are working with local and national authorities on preparations and strategies to reach all people, including those in hard-to-reach locations. Using existing immunization infrastructure, we are also working to reach people who are not normally targeted in our immunization programs, including health workers, the elderly, and high-risk groups. And we're helping governments to establish pre-registration systems and prioritizing which people, such as healthcare workers, need to receive vaccines first. We're engaging communities and building trust to defeat misinformation. We are training health workers to deliver vaccine and helping governments to recruit and deploy more health workers where they are needed most. We're advocating with local and national governments to use other proven health measures like masks and physical distancing. And now through the COVAX facility, we're working with Gavi and WHO and CEPI to procure and deliver the COVID vaccines in the close collaboration with vaccine manufacturers and freight and logistics and storage providers. And we're doing so on a dramatically accelerated timeline. We're aiming to procure 2 billion doses of COVID-19 vaccines by the end of this year, 2021. This is on top of the 2 billion doses of other vaccines we normally procure each year on behalf of 100 countries. With our long-standing work in humanitarian contexts, we're adapting, adjusting, and assessing the specific needs in each location. This means, for instance, ensuring that enough doses and syringes are available in each country and undertaking inventories to ensure that effective cold chain systems are in place. It means procuring those syringes and safety boxes. It means finding ways to ensure distribution and delivery in logistically difficult contexts like Sudan or the Democratic Republic of Congo, or high-threat environments like Yemen or Afghanistan. It means negotiating to populations across multiple lines of control by non-state armed groups, areas that the ICRC estimates represent some 60 million people. It means ensuring that all populations groups, including those that are routinely excluded from support, are covered by national vaccination plans, no matter their legal, economic, or political status. This includes refugees, migrants, and those who are deprived of their liberty. And we've joined a global effort to secure vaccines under the humanitarian buffer that can be used as a measure of last resort. COVAX has set aside 5% of its doses as backup stock for at-risk populations like refugees, the internally displaced, and migrants. In short, it is a safety net for those not covered by national immunization programs. But as we prepare for this historic rollout, we need the support of this Council. So may I build on the Secretary General's calls. First, join our call to all member states to ensure that everyone is included in national vaccination plans, regardless of their legal status or if they live in areas controlled by non-state entities. Second, we need a global ceasefire. At a minimum, we need your help to extend the call made in Resolution 2532 for a humanitarian pause for the duration of the vaccine delivery and administration. And third, help us to restart stalled immunization campaigns for other diseases like measles, diphtheria, and polio. We cannot allow this fight against one deadly disease to cause us to lose ground in our fight against others. Over the last year, the global community has come together to develop, manufacture, distribute, and deliver this vaccine in record time. So in closing, may I say that this historic effort deserves historic support. Help us ensure that the light at the end of the tunnel shines on us all, including the families and communities enduring the horrors of conflict. Thank you very much, Mr. Chairman.
Thank you very much, Ms. Moore. Thank you for your briefing and for all the work that the Children's Fund is doing. I now turn and give the floor to Dr. Seth Barkley.
Mr. President, Mr. Secretary General, Excellencies, thank you for inviting me to brief the Security Council on a topic that will define our common success in addressing the pandemic through equitable access to vaccines. Let me also thank my partners, Henrietta and Jagan, who are here with me today. For a global pandemic, as the Secretary General has said, we're only safe if we're all safe. If there are countries where large numbers of at-risk people are not vaccinated, it not only threatens those countries, but the rest of the world, as the new variants popping up in different countries attests. So the first goal is to assure equitable access, but we can't stop there. To succeed, we need to ensure that vulnerable at-risk populations everywhere have access to life-saving vaccines. This means not forgetting the millions of people in conflict-affected settings, for it is in these last-mile communities where the meaning of equity is most pronounced. The COVID-19 pandemic has laid bare deep systemic inequities between and within societies, exacerbating grievances and conflicts along the way. Progress on poverty eradication, nutrition, education, and immunization coverage have all fallen back, and the poorest and most vulnerable communities are hardest hit by the pandemic. Despite the UN Secretary General's call for a global ceasefire, conflicts and political violence have continued or even intensified. The pandemic is more than a global health crisis. It's a significant challenge to international peace and security that can only be addressed through multilateral cooperation. Global GDP is expected to fall by as much as $9.2 trillion in 2021 if countries continue to pursue an uncoordinated approach to vaccine distribution. This only weakens our collective ability to ensure peace and stability. For over 20 years now, Gavi, the Vaccine Alliance, has worked to give the protection of new and underutilized vaccines to more than 800 million children and to support global health security by financing global stockpiles for epidemic diseases such as Ebola, horribly in the news this week again. Our target for the next 5 years is to reach children who receive no routine vaccines, the so-called zero-dose children, 2/3 of whom live below the poverty line, and an estimated 40% living in settlements affected by fragility. Vaccines work against poverty and conflict too, by giving children in particular the same life chances that makes access eligible. Sadly, there is a correlation between conflict and underperformance in immunization. Countries in the Gavi family that are not suffering from fragility reach on average 83% of children with the first dose of vaccine, while countries affected by conflict, this drops to 65%. This is further compounded by challenges to healthcare provision in conflict and fragile settings where access to healthcare and infrastructure are disrupted or restricted where they're needed most, furthering exacerbating the deprivations and inequalities and driving displacement. In response to this, Gavi's fragilities, emergency, and refugees policies provide greater health systems funding and flexibilities to eligible partners and countries. But it isn't just the vaccine. It's also, as Henrietta said, the supply chain, the bravery and professionalism of the health workforce, and the development of humanitarian actors that is totally essential. After all, vaccines don't deliver themselves. So now let me come to the biggest test of a multilateral system in a generation. As I have long said, epidemics and pandemics are an evolutionary certainty, and vaccines, where they exist, are an essential tool in preventing these and protecting us all from new diseases. They're an essential investment in both national and international security. A health budget is a defense budget, and investing in vaccines for COVID-19 and for other diseases is a fundamental pillar of global health security. Along with securing and supporting populations impacted by conflict, it's important to consider pandemic preparedness, disease and virus surveillance, and security of supply lines, security of health workers and facilities. That is why, as my colleague Henrietta Fore explained, COVAX and its goal for equitable access is so critical to ending the acute phase of the pandemic. And this goes hand in hand with access to diagnostics, therapeutics, supply chains, and health systems innovations. As part of the COVAX facility, a proposed humanitarian buffer will enable access to COVID-19 vaccines for high-risk populations in humanitarian settings, especially where they are at risk of being excluded or where governments and health ministries have no access due to conflict. While we work on this safety net with the strong support of our humanitarian partners in the Interagency Standing Committee, COVAX and our partners are clear that the first resort for covering all the high-risk groups, irrespective of their legal status, is their inclusion in the country's national vaccine plans. The humanitarian buffer is but a measure of last resort. I ask that the UN Security Council to reinforce this message so that available doses are distributed to ensure truly equitable access in accordance with the humanitarian principles and in upholding state obligations towards populations within their territory. COVAX has secured 2.3 billion doses of vaccine in advanced commitments and options for 190 countries in 2021. Of these, at least 1.3 billion doses are reserved, but not fully paid for with donor funding. These doses are meant for 92 lower-income countries eligible for the COVAX advanced market commitment, which could increase to a further 1.8 billion doses that could be delivered with additional financing. Given the new variants, it is clear that we will have to adapt vaccines and strategies, and this may further increase the required cost. It's critical that donors and countries step up with additional funding, that manufacturers prioritize multilateral initiatives over bilateral deals with short-term profit, stop inequitable vaccine diplomacy, that research and development and essential scientific knowledge is shared, and that the family of nations represented by the United Nations pull together and prepare for the largest logistical effort in immunization the world has ever seen. It's also fundamentally important that where the vaccines are available, the Security Council plays its critical role in enabling supplies to move into conflict-affected settings via neutral humanitarian actors in accordance with international law. Mr. President, Excellencies, as an epidemiologist who has specialized in infectious disease epidemiology over a lifetime, as the head of Gavi, the Vaccine Alliance, and the COVAX facility, I can say that science tells us there is no way out of this pandemic alone. We have to do it together or face generational consequences. Our ask to the Security Council is that they advocate for and invest in this unprecedented effort, that they call on all nations to ensure the unhindered deployment of vaccines in all settings, including those affected by conflict, and into the arms of all high-risk individuals, refugees, or citizens. As we now know, global health security is key to economic and human security, progress, and stability, and we overlook it at our own peril. No one is safe until we are all safe. COVID-19 is the biggest stress test of the multilateral system we've seen in decades. It has affected every person, every community, every country on Earth. We must get this one right, particularly as it is an evolutionary certainty that this will not be the last pandemic. Thank you for listening.
Thank you so much, Dr. Barkley, and thank you for the work you're doing and that Gavi is doing. I now give the floor to Mr. Jagan Chapgayan. Over to you.
Please check your microphone. We can't hear you. Are you on mute, please? Check.
Yeah, you hear me now?
Yes, please go ahead. Thank you.
Yeah, Mr. President, thank you for the opportunity to join this important discussion today. Your Excellencies, dear colleagues, COVID-19 has shown us many things. It has highlighted painfully the weaknesses inherent within our public health systems. It has underlined our interconnectedness and the importance of responding to a global pandemic in a coordinated way. And it has shown the deadly consequences of mistrust. It seems sadly appropriate that I'm speaking to you about trust just days after a new Ebola outbreak was announced in Guinea. The parallels between Ebola and COVID-19, both in terms of the destructive nature of mistrust and transformative capacity of creating trust, are profound. What happened? Couldn't fix it. It was the problem. When communities do not understand health interventions, they will not accept them. Instead, they are likely to see these health measures as threats, which can lead to violence. We saw this many times during the Ebola outbreaks, and we have all seen this many, many times during the COVID-19 pandemic. Put simply, mistrust kills. When science is not only ignored but derided, when the decision to wear masks becomes controversial, and when the wave is filled with absurd rumors, trust in the tremendous efforts to stop the pandemic is severely undermined. When mistrust prevails, it stops people from getting the help they need. It prevents us from ending public health emergencies. It can even lead to people incorrectly blaming others, foreigners, migrants, or other minority groups for the spread of an illness. What can be done? A crisis is not the ideal time to rebuild trust. However, it can be done, but it requires listening and sincerity in acting on what communities tell us. Let me give you an example. Our initial attempts to safely bury Ebola victims in the Democratic Republic of the Congo were met with hostility. So we reached out to communities and we listened. We trained 800 community volunteers to gather community feedback, and we analyzed the results to understand why people were refusing our support. We used what we learned to adapt, both how we handled the burials and how we engaged with communities. And the result of this diligent, patient work was that refusals dropped from 80% to just 8% by the end of the outbreak. Trust has to be earned. It requires seeking out community feedback and constantly adapting our response to address the concerns and fears that periodically flow through communities. It also requires investment, certainly more than has been the case during this pandemic. Mr. President, mistrust has consistently undermined COVID-19 response efforts. Now, as we turn to the immunization phase of the global response, earning community trust remains crucial, especially against the backdrop of historically high levels of vaccine hesitancy. As we learned during Ebola, people trust us for our actions. They look at what we do and they judge us for what we do not do. They see clearly the current high levels of vaccine inequity and inequality. They see the unfairness, for example, in the fact that less than 1% of vaccine doses globally have been administered in the 32 countries facing severe or very severe humanitarian crisis. The fair and equitable distribution of vaccines is essential to building trust and for maintaining international peace and preventing violence. This is about more than fairness. This is about stopping the virus. However, equity is not something that happens on its own. History tells us that. Just as we need to ensure that all countries can access vaccines, we also need to make sure that those vaccines reach the arms of all the people who need them. Underserved, alienated, or isolated communities, including those living in areas not under the control of states, as well as detainees, IDPs, and refugees, must be integrated in national vaccination efforts. Strong involvement of the International Red Cross and Red Crescent movement and other local impartial organizations in vaccination activities can help ensure that these last-mile communities are not left behind. The efforts of the National Red Cross and Red Crescent societies to maintain routine immunization in contexts like Afghanistan, the Central African Republic, and Pakistan have saved countless lives. This unparalleled access into last-mile communities can just as easily channel COVID-19 vaccinations while maintaining critical routine vaccinations. The vaccination campaign we launched just last month to help vaccinate 500 million people in support of the global efforts was born out of this reach and the trust of our membership at the most local level. How can you as UN member states support these efforts to build trust and integrate last-mile communities into COVID-19 immunization efforts? You can include community organizations such as the National Red Cross and Red Crescent societies in all phases of immunization planning and delivery. By involving these actors, you will gain insight into community misconceptions and misgivings, and will gain sight of those groups and communities that might normally be hidden from your view. Mr. President, I would like to stress the importance of ensuring the safety and protection of volunteers, first responders, and healthcare workers during this pandemic. In 2020, my colleagues at the International Committee of the Red Cross documented nearly 850 incidents of violence against healthcare workers involved in the COVID-19 response, a figure that is both shocking and almost certainly an underestimate. International humanitarian law must be respected. Violence against healthcare workers must not be tolerated. We have a collective responsibility to care for those who care for us. Mr. President, let me conclude by thanking the millions of volunteers who are serving on the front lines of this pandemic. By selflessly responding to the needs of others, each of them create tiny ripples of hope. I believe that these ripples will build trust and eventually turn into the wave that washes away this pandemic. These volunteers prove that humanity is not only alive, but is in fact thriving, giving us all hope for peace and security as we deal with the toughest crisis of our lifetime. Thank you, Mr. President.
Thank you, Mr. Chapgayan, for your briefing and the work of the Red Cross and the Red Crescent. I will now make a statement in my capacity as the Secretary of State for Foreign, Commonwealth and Development Affairs for the United Kingdom of Great Britain and Northern Ireland. Your Excellencies, I am very pleased and honoured to address this first ever Security Council meeting on vaccinations. It is, I think, right that we bring the full weight of the Security Council and the wider UN system to bear on ending this appalling pandemic. The virus, we know, is still on the rise globally with the emergence of new, more...
Well, that's a live conference of COVID-19 vaccines in context affected by the conflict and insecurity. And of course, we will be following up on how the vaccine rollout has been taking place on day one. But first, let's take a break.